So I want to give a great thank you to Representative Adams and Sandhya for that insightful discussion, and to Representative McMorris Rogers for that thoughtful message. Now, I'm delighted to be joined by a great panel. Dr. Rahul Gupta, who's the Vice President, Chief Medical and Health Officer, and Interim Chief Scientific Officer at the March of Dimes, and Jonathan Webb, who's the Chief Executive Officer at the Association of Maternal and Child Health Programs. Welcome. First, Dr. Gupta, if you can start off by explaining the motivation behind the hashtag Blanket Change campaign.
Thank you, Mary, and thank you everyone listening, and really a big thanks to my panelists here, Jonathan. Really appreciate the partnership as well as the work. We believe that clearly, it has been stated earlier, that the maternal and infant health crisis is complex, and there's no one-size-fits-all solution. We have to tackle it from multiple angles, focusing on everything from access to care, to physical and mental health, to the social determinants, and much more. We believe that a critical way to create positive change is through advocacy. That is the reason why we launched the hashtag Blanket Change digital advocacy campaign to call on organizations, to call on policymakers and political candidates to prioritize our nation's moms and babies and take immediate action to help end the maternal and infant health crisis. We believe that all these more than 70 organizations nationwide, including AMCHIP, American Academy of Pediatrics, and others that are coming together here to support this campaign, really stand alongside us to demand blanket change by demanding really equity, access, and prevention. It's exciting to see so many of partners come together to join this important movement in this moment of time in our nation's history. And we hope, certainly, that on this call, those who have joined us are beginning to take action now at blanketchange.org.
Great. I know that the March of Dimes did a report in September, and I would like for you to share with the folks who have gathered, what are some of the bullet points from that report that surprised even you and that need particular and immediate action?
Yeah, Mary, that's a great important point, because one of the things we wanted to look at, we had done a maternity care desert report back in October of 2018, and we wanted to follow that up in 2020 to see if anything changed. And we're indeed not surprised, but at the same time, I will count for you and for our audience what we found. Basically, we found that a significant amount of counties across the United States still continue to have limited or no access to maternity care. Think of maternity care deserts like food deserts, except that we call a maternity care desert when a county has no OB provider or no hospital to provide that care. And there can be variations in insurance status. So we see that about 7 million women of childbearing age live in one version of a maternity care desert or another. We also know that these areas are for about 500,000 births that happen in our country. We know that out of these, there is about 2.5 million or 2.2 million to be exact, women that are living in absolute desert, absolute areas. 35% of the nation's counties do not have this access, and it's unfortunate. We also know that all of these factors ultimately accumulate to result in poor outcomes. We used to think maybe it's a rural area problem only, but now we know that about a third of the deserts may exist in urban areas, often inner city metropolitan areas. So it's important that these moms who have already an increased chance of risks for maternal and infant health in terms of death and suffering, including low birth weight and preterm birth, we prioritize them. We also know that Black women, especially, have at least 3 times more likelihood of dying as a result of pregnancy-related complications as opposed to white women. And one of the factors there is, of course, is quality of care, but access is important and availability of care is also important. So our idea behind the proposing and developing this maternity care desert report is to really demonstrate the unequal access to healthcare that so many of our populations continue to receive and how that's unacceptable. And it is actively contributing to the rising tide of this crisis of maternal infant health.
Thank you. I want to bring Mr. Webb in right now because Dr. Gupta has surfaced some really disturbing statistics and disparities. So I wonder if you could talk about the importance of eliminating particularly these racial and ethnic health disparities and what the current research shows us.
Well, Mary, thank you for having me first off. And Dr. Gupta, really appreciate the invitation and the partnership that we enjoy. It's a great question. And to answer it, I'll start with my definition, the definition that we've been working from on health equity. It really is around everyone deserving the right to a fair and just opportunity to be healthy. And frankly, we don't see this and haven't achieved this in the US and is reflected in our health outcomes. As one of the richest countries in the world, we have the highest maternal mortality rates among developed countries. And Dr. Gupta touched base on this, but Black women are dying at 3 to 4 times the rate of their white counterparts. The US infant mortality rate is 5.7 deaths per 1,000 live births. And those numbers by race and ethnicity show that the infant mortality rate for non-Hispanic Black infants is twice that of their white counterpart. So when we look at the importance of eliminating these disparities, it's because each one of these deaths, when you talk about maternal deaths, is the loss of a mother, the loss of a wife, a daughter, a friend, and a community member. And when you look at this through the lens of infant deaths, each one of these losses is the loss of a potential future leader, a world changer, a problem solver, a cure finder. And these losses are experienced not just by the families, which is a huge loss to the family, but it's also a loss to us as a larger community. So it's important for us to eliminate these disparities because the stakes are just simply too high not to. And to your question around what the research shows us, it shows us a few things. So one, as Dr. Gupta mentioned earlier, we have, in the public health community, been looking at the social determinants of health, which are the conditions in the places where people live, work, learn, play. And those conditions affect the health and the quality of life risks and outcomes. We've started to transition to this life course theory approach and understanding, which is that the birth outcomes for mom and babies are not simply impacted by their experiences prenatally, but the experiences, traumas, the things they've accumulated and experienced throughout the course of their life. So where we are now with the research, pulling all this together, is that we are recognizing that the environments in which we live and develop, the social determinants, and the lifetime experiences that impact the health and outcome and maternal child health outcomes of life course theory are influenced by racism. And structural racism exists in every major system that influences those factors: healthcare, education, housing, workplace, child welfare, criminal justice, and it causes intergenerational stress for people it impacts, and likewise determines the investments and the policies that support or hinder community well-being. So if we're looking to really address this issue, we need to shift our conversation from eliminating racial and ethnic disparities in maternal and infant health specifically, which continues to focus the blame on people, to eliminating the systemic, structural, and institutional inequities that produce the racial disparities. We also need to be honest and acknowledge that these systems, these structures, and these institutions were not created to produce equitable outcomes for Black, Indigenous, Latinx, Pacific Islanders, and other people of color. These are products of systems created over time that create an advantaged group or a disadvantaged group, in part because communities of color have not had seats at the table in creating these systems. So where I'll end with this portion of the question is an analogy that I've heard offered a couple times before that really kind of brought this home for me, and it compared our system to a game of Monopoly. And for those of you, I think most folks are familiar with Monopoly. It looks at our system as this game where you have a game being played by a family of four, where three people sit down to play the game, and the fourth is asked to kind of finish their homework, do their chores, whatever it might be, while the rest of them play the game. While that person is doing their chores and their homework, the family of three has gone around the board several times. If you've gone around the board several times and then you're invited into the game, there's no more property. Everyone's got houses set up, they've got hotels set up, and you're coming into the game now just going around the board, paying $200 to pass go and paying others rent. And our system is set up in that way that if we don't look at really dismantling or look at the system that we're playing in, we're going to be building programs that give folks $200 to pass go, but not really address the inequities that are at the base of the game. So that's why.
Yeah, well, thank you for laying it out that way. I think it's a great time to transition to some solutions. So Dr. Gupta, can you give us some details on the work that the March of Dimes is doing to improve maternity care access?
Certainly, Mary, and thank you for that. We certainly have challenges. We continue to see challenges in our nation, even today. One of the primary things we're doing is advocating for important policies that will expand access to care along with our partners. In fact, we've made great progress in just the last few weeks, if you look at it, because the House of Representatives and Congress have passed 2 bills that actually would help improve access to care. Now, we understand the realities, we understand the politics. However, I do want to hold up the great work that has happened so far. One of those is called the Maternal Health Quality Improvement Act of 2020, or HR 4995. It does a few things. It actually develops these health programs to improve access to obstetric care in rural areas. It reduces and prevents the racial and ethnic discrimination that happens, that Jonathan's talked about in maternal health. It improves perinatal care and health outcomes and eliminates preventable maternal death and severe health challenges. So there are solutions that are happening right now as we speak. Similarly, there's another piece of legislation that allows, it's called Helping Medicaid Offer Maternity Services Act of 2020. That bill, HR 4996 companion bill, allows extending the access to health insurance for Medicaid and CHIP for mom up until 1 year after birth. These are the kinds of changes that need to happen now, urgently, and we really would like to see, amongst everything else that's going on, the Senate take these up and pass these important pieces of legislation. It can be done. It's a matter of those who are listening to us going to blanketchange.org and helping us achieve that. We also support some of the other pieces like the Black Maternal Momnibus Act of 2020, a package that actually aims to fill gaps in existing legislation to improve outcomes for Black moms, as well as the Family Act, which actually looks at creating affordable, sustaining national system to provide workers up to 12 weeks of partial income through family and medical leave insurance fund. So the bottom line here is that it's not a matter of what we don't know how to fix it. We know how to fix it. There are policy changes that can happen that can really change the way we take care of our people, especially our moms and babies, and certainly especially those of color that are bearing the most burden in this crisis. Yet, we need help. We need the help of those who are listening to us, who are watching us, to take action. Without that, we will not be able to change. So we're making a call of everybody to go to blanketchange.org and make it count for all of us, and especially for those who are the most vulnerable amongst us.
Oh, I want to thank you. You've given us our marching orders, Dr. Gupta, and a lot of action to be done. I want to thank you, Jonathan, Mr. Webb, and Dr. Gupta for speaking with all these wonderful listeners today and giving us some action items. I'd now like to pass the discussion over to Stacy, who will be moderating our final panel discussion, and her interview will begin in just a moment.